My colleague, Representative Comer, said earlier today that he's concerned that government would have more of a role in medicine. And his concern is that if government has more of a role in medicine, it may hurt, as he put it, our innovation. I'm hoping, Dr. Kesselheim, that you can maybe put him at ease with facts. Because as I understand it, my colleague, if he cares about innovation, should actually be cheering for government to have a bigger role. I know you're familiar with the study that shows that between 2010 and 2016, of every drug, all 210 drugs that were approved by the FDA were funded by the NIH or public money. Dr. Kesselheim, can you speak, because you're such an expert in this area, about the role of public dollars in innovation and your judgment about whether the public investment is more responsible for innovation or the private pharmaceutical companies?
Well, I mean, so the study that you're referring to is an important one, and it showed that all drugs that come out on the market in some way can be linked to NIH-funded research that helped understand the enzymatic pathway or understand the mechanism of action of the drug, and do some of this basic research and this translational research that occurs in the laboratories. And I think that that's an incredibly important role that the U.S. government plays in funding that research, and that helps float all boats. All drugs come out of those. There are some drugs in which the U.S. government investment even goes further, and there's development and isolation of the compound by NIH-funded research. Usually, though, at some point in this translational process, the pharmaceutical manufacturers get involved as well at a later stage, and then there's a lot of investment in the pharmaceutical manufacturers as well for a number of products at a later stage as well. I think the most important thing is both to make sure to understand that the public investment expands throughout the entire pharmaceutical space. But also that the private industry plays an important role as well, and we need to make sure that there is appropriate balance between the two and recognition of the public role, particularly as it relates, and we did this study showing particularly as it relates to transformative drugs and the most important new drugs, that it tends to be public funding that takes those products sort of much of the way through the development.
Would it be fair to say that most of the foundational research is being done with public dollars, and that, I mean, this is just sort of common sense. If you know the people who go do their MD, PhDs and want to win Nobel Prizes, they tend to go to universities, not becoming general counsels or vice presidents at pharmaceutical companies. I mean, is that not your experience?
Yes, and actually I think that's happening more and more. It used to be the case that a lot of large pharmaceutical companies had really big research arms, but in recent years a lot of those companies have divested from those research arms and instead are looking for the research that's coming out of the academic settings. And I want to also bring back to what other people have said earlier in this hearing about the need for a financial incentive. And actually, a lot of these people at Harvard and at Johns Hopkins, a lot of these scientists go to work every day, and their incentive is to try to cure disease and to make people better and to progress and to develop the progress of science. And they're not thinking about whether or not they can become a billionaire or whatever, right, because of that. That's the incentive.
What an odd concept, right? I mean, like members of Congress. I mean, don't you think here most people would think they don't want to make just $1 billion, they're in it for the public good? What an odd concept that someone else may have a similar view. Let me just address one comment that Dr. Roy made and then have the panel address it. I was a little perplexed because Dr. Roy said that the FDA comes up with these difficult standards and that government then is unable to meet those standards. It's like saying a high school calculus teacher is capable of making a high school exam but won't be capable of passing that exam. How can government be competent enough to come up with the standards, and then you're arguing that government isn't competent to meet those standards? Was it something I was missing in that argument, or is it just defies common sense?
I mean, the FDA is doing its best to try to make sure that when drugs are approved, they're as safe and as reliable as possible. And in fact, the FDA is the fastest drug regulatory agency in the world. I don't think that it's right to blame the FDA. The FDA is there to help and is actually helping drugs get to the market, but want to make sure that when those drugs get to the market, that patients and physicians can rely on them being interchangeable and can rely on them to help the conditions that they need.
Well, thank you. I see my time has expired.
Thank you.